called the Middle East respiratory symptom coronavirus, and 27 people so far have died from it. What it does, it sort of comes on like a cold, and then it attacks the respiratory system. It can lead to pneumonia and eventually kidney failure.
Joining us from Abu Dhabi, CNN's Leonie Lakhani. And Leonie, first of all, how does one get contract this virus, and what do we know about the people who have it now?
Well, so far, Suzanne, we've got 49 cases worldwide reported by the WHO, 27 deaths. One of the main issues is no one really knows how this virus is spreading. Doctors are basically treating the symptoms, whether it's a cold, pneumonia, other respiratory diseases. The majority of them have ended in very severe complications, and they're saying it's very difficult to prevent future infections because they don't really know how it's being spread exactly. Having said that, we spoke to a WHO representative, and he said one of the main concerns is a high fatality rate, and this is what he had to say.
We don't know how it spread. This is one of the big pieces of the puzzle. As you said at the beginning of your remarks before I came on air, this is of grave concern to us here internationally in WHO because there are so many unknowns around a virus which so far has killed 55% of the confirmed cases. We would believe that the virus has a reservoir somewhere in the animal world, but we don't know which animal. And then we don't know if the virus transmits directly from animals to humans or via intermediaries. We need to find out this and a lot of other information.
Now, earlier this month, the WHO did verify some human-to-human transmission in Saudi Arabia between healthcare workers who were in very close contact with patients. And if that is what they're concerned about right now, and that, of course, has some very worrying consequences, Suzanne and Michael.
Yeah, but Leonie, how then are they going to work to try to contain it? It's called the Middle East virus for a reason. It is originating there, and the gentleman who died in France had actually been in Dubai. So what are they doing to try to lock it down, fight it?
That's one of the issues, Michael. I mean, the WHO says, we don't want to put a region on it, but in this case, it's acceptable because all the cases so far have originated in the Middle East, the majority in Saudi Arabia. More than half the cases were in Saudi Arabia, 18 deaths at least in Saudi Arabia. So right now, they're trying to just contain whatever they can within those regions, Saudi Arabia specifically, covering their mouths, covering the patients, trying to quarantine them. But until they know exactly how it's spread, it's going to be very difficult to contain. They're just trying to locate the actual cases. So you've got Saudi Arabia, Qatar, possibly the UAE, possibly Tunisia, now spreading to Europe with France, a case in the UK and Germany because of travelers, but they can't really confirm that was the cause, and that's the main issue, Michael.
And Leonie, real quick here, are there any travel warnings because it is specific to that area, not to travel in that area, to be particularly cautious?